Here's how I perform my neck pain examinations, part 2, laying. So part 1 of my neck pain examinations focused on what I did with the patient in sitting, and now part 2 is what I do with the person laying down. This is where I can really narrow down what classification the person might be presenting as according to the neck pain clinical practice guideline. Just as a reminder, those classifications are neck pain with mobility deficits, movement coordination impairment, radiating pain, or headaches. So I start with a cervical distraction test, especially if someone is presenting with symptoms into the arm or shoulder, then right into a cervical flexion rotation test like shown in the video here. After that, I'll typically do a neck flexor endurance test. I'll speed this up because Des could hold it for a pretty long time and you get the gist. After the neck flexor endurance test, I will go into my upper limb tension testing, again, especially if someone is having symptoms into the arm. So I start with upper limb tension test A, which is the median nerve bias, and then I do the upper limb tension test C, which is the ulnar nerve bias. Then I flip around and do upper limb tension test B, which is the radial nerve bias. After that, I'll have the person flip over onto their stomach, and that's where I do some testing with the person in prone. This is where I'll do joint mobility testing of the cervical and the thoracic spine. Sometimes I will do the cervical spine in supine depending on how difficult it is for the person to attain prone, and then I'll usually knock out a couple of manual muscle tests while the person's in prone as well. So I'll do middle trap, then I can do rhomboids while they're here, and then a shoulder extension or lat MMT. So that's the basic framework of my neck pain evals. Not having the person switch positions a bunch of times is pretty efficient. If I have to do any sport specific or work specific stuff, I'll do that at the end of the exam. But overall, this exam takes me about 15 minutes. Follow me for more PT content.